Hello, and welcome to NCG's webinar, PQRS 2014, Make It Easy. As your practice advocates, we are helping to redefine the way healthcare is delivered. Since 1979, our mission has been to provide software, strategy, consulting, and technologies that help create next-generation RCM solutions. We make it possible for healthcare organizations throughout the country to reap the benefits of our entire suite of tools designed to maximize practice management benefits and overall cash flow. NCG Medical, in a little over 3 decades, has affected over 2,000 healthcare facilities nationwide with services ranging from practice mergers and acquisitions, strategic planning, financial advisory and compliance, to operation improvements, transaction facilitation, and clinical and technology integration. But the important message here is not longevity, it is dependability. Improving the way healthcare is delivered is not just a tagline, it's what we do, one client at a time. First, I'd like to introduce myself. My name is Heather Miller, and I have been working in the healthcare industry for over 20 years. I've assisted hundreds of practices with diagnosing and solving practice problems. These issues range from revenue cycle management, Medicare and Medicaid compliance, some practice and workflow analysis, the implementation of electronic healthcare records, as well as attestation and PQRS reporting. I'm excited today to share with you NCG's PQRS 2014, How to Make It Easy. So let's review the agenda for today's presentation. First, we'll discuss what PQRS and quality data codes are. Then we'll discuss why it's important for you to participate in the 2014 PQRS program. I will show you 3 options on how you can participate this year and then walk you through how to make it easy and take the pain out of PQRS. Last, we'll discuss the options for reporting and conclude with some good PQRS reminders. The Centers for Medicare and Medicaid Services has developed several quality initiatives that provide information on the quality of care across different settings, including hospitals, skilled nursing facilities, home health agencies, dialysis facilities, and ambulatory practices. CMS believes these quality initiatives aim to empower providers and consumers with information that would support the overall delivery and coordination of care, and ultimately would support new payment systems that provide more financial resources to provide quality care, rather than simply paying based on the volume of services. The Physician Quality Reporting Initiative, or PQRI, was formally launched under a provision of the Tax Relief and Healthcare Act of 2006. In 2011, the program name was changed to the Physician Quality Reporting System, or PQRS. The PQRS program provides a financial incentive to eligible professionals for voluntarily reporting data on specific quality measures applied to the Medicare population. Under PQRS, incentives will be paid simply for satisfactorily reporting on designated quality measures. However, it is anticipated that PQRS eventually will be transitioned to a formal pay for performance model. CMS uses the word report to mean a claim form where the medical services reported indicate an opportunity for PQRS measure reporting. PQRS measures are available to indicate that the measure was performed or not performed based on an acceptable exemption or exclusion. If a specific PQRS code is not submitted, the opportunity to receive the financial incentive is forfeited. So what is a QDC? Practitioners are required to report their PQRS compliance by submitting quality data codes, or QDCs, that correspond to the selected measures they choose. Measure codes contain information about PQRS quality measures, including a detailed specification and related release notes for the individual PQRS measure and the group, as well as other related documentation needed by the individual eligible professionals for reporting the PQRS measure through claims or registry reporting. The PQRS measure documents for the current program year may be different from the PQRS measure documents from the prior year. It is the eligible professional's responsibility to ensure that they are using the PQRS measure documents for the correct program year. So basically, a QDC is a G code that corresponds to the data that you will report so Medicare can identify what you have completed. Again, these reports can come in several ways. On the billing form, which is your Medicare 1500 form, through a registry or a data warehouse, and now through your EHR, or electronic healthcare record. At a minimum, the following factors should be considered when selecting measures for reporting. Your typical clinical conditions you usually treat. The types of care you provide. Are they preventative, chronic, acute? Settings where care is usually delivered. Is it in the office, the emergency department, or a surgical suite? Related to your quality improvement goals for 2014, as well as any other quality reporting programs that you might be in or considering to be in. CMS has a document that lists the quality data code categories for you to review. Provided here is a direct link to this document that includes all of the specifics you will need to know. So despite strong opposition from the physician community, CMS finalized calendar year 2014 as the performance period for the 2016 PQRS penalties. Therefore, if CMS determines that an eligible professional has not satisfactorily reported through one of the finalized 2014 reporting options for avoiding a payment adjustment or qualifying for a payment incentive for the January 1st, 2014 through December 31st, 2014 reporting period, the fee schedule amount for services furnished by this participating professional during 2016 would be 98% of the fee schedule amount. CMS has established different reporting requirements for individual physicians and non-physician providers, as well as group practices participating in 2014. PQRS program participation requirements to qualify for a payment incentive differ from the requirements for avoiding a payment penalty, to avoid the payment adjustment. So let's look at this a little clearer. Here's a picture of the breakdown of the incentive and penalty payment schedule, clearly showing the importance of ensuring you are prepared to meet the PQRS 2014 requirements to avoid the 2% penalty in 2016. And even more important, the ability to still take advantage of a 0.5% incentive payment for the compliance year. As you can see, these penalties are not going away in 2015. There is another 2% penalty for noncompliance that you will see in 2017. For those of you that have not started your PQRS program requirements last year in 2013, you will begin seeing your penalties next year. My goal today is to show you a way to avoid these penalties and take advantage of the incentive funds without all the pain. So let's take a closer look at how you can do this. When asking, should you participate, you have three options to choose from. Let's start at the bottom. And when asked, should I participate in PQRS 2014, you say no. I will just take the 2% hit and basically do nothing. Now moving on up, instead you answer, well, yeah, I want to avoid the penalty, but I don't really care about the incentive. That's going to lead you to two options. Option 1, reporting 3 individual measures via your CMS 1500 claim form. Or Option 2, reporting 3 individual measures or 1 group measure via a certified CMS registry. And then your final third option would be, yes, I want to participate and qualify for the bonus and avoid the penalty. Again, leading us to two options. Option 1, reporting 9 individual measures via your CMS 1500 claim form. Or Option 2, reporting 9 individual measures or 1 group measure via a certified CMS registry. Now you might already be saying to yourself, this is way too difficult for me, and I'm just going to take the hit versus trying to figure all of this out. Or asking yourself, how am I going to find 9 measures that apply to me in my practice and then document and report all of that information? All valid comments and questions to be asking yourself, but I'm here to show you the truth. It really can be easy. And I'm going now to show you how. To make this easy, we are only going to discuss measure groups. And why only measure groups? Because this is the easiest and simplest way for you to be able to report PQRS for 2014 and not only avoid the penalty, but also receive the incentive payment. Let's start with what is a measure group. There are 25 measure groups that have been established for 2014 PQRS, and this slide lists them all. Asthma, back pain, coronary artery bypass graft, coronary artery disease, cataracts, cardiovascular prevention, chronic kidney disease, chronic obstruction pulmonary disease, dementia, diabetes, general surgery, heart failure, hepatitis C, HIV/AIDS, inflammatory bowel disease, vascular disease, oncology, optimizing patient exposure to ionizing radiation, Parkinson's disease, preoperative care, preventative care, rheumatoid arthritis, sleep apnea, and total knee replacement. Each of these 25 measure groups consists of individual measures established for use in the 2014 PQRS program. An eligible professional may choose to report one or more measure groups through registry-based submission. This is the first year that the option of reporting a measure group via claims has been removed. An overview for each measure group is available in a manual for CMS that includes specific reporting instructions for each measure within the group. Here is a direct link to the CMS website and where you can access and download these resources. There is a zip file located on this web link that includes this Getting Started manual as well as specification manuals and release notes. Pretty much anything you would need if you had further questions regarding the specific measure group you select. So let's get back to why this is so easy and why choosing to report one measure group over the 3 or 9 individual measures is the way to go. It all comes down to the reporting requirements. For a group measure, you are only required to report on a 20-patient sample for the full reporting period, which is the 1 calendar year. And only 11 of those 20 need to actually be Medicare Part B patients. Different from the individual measures where you are required to report on 50% of the qualifying Medicare B patients for the full calendar year. This can be a cumbersome and overwhelming task for most. So again, making it simple, pick one measure group and find 20 applicable patients, and you're done. So now the big question is, which measure group is the right one for me? As I listed them before, most of you might have seen a measure that jumped right out at you and said, hey, I have lots of those patients, and that's great news. For those of you that didn't, I'm going to use one measure as my sample measure that any provider out there, regardless of his or her specialty, can use and successfully report for PQRS 2014. And that sample is preventative care. The rules for how to report a measure group apply the exact same way for each of the measure groups. The only difference is that each group has their own list of measures and qualifying encounter and diagnosis code specifics. But for this case, we are going to walk through the specifics of the preventative care measure. To begin, the patient sample for the 20-patient sample method is determined by diagnosis and/or specific encounter parameters common to all measures within the selected measures group. The preventative care, you can see that the qualifying patient encounter codes are the 99201 through 99205, your 99212 through your 99215. So basically any new or follow-up visit for a patient that is over the age of 50. All applicable measures within a group must be reported for each patient within the sample that meets the criteria, i.e. age or gender. For example, when an eligible professional is reporting on this preventative care measure group, the screening or therapy for osteoporosis measure would only need to be reported on women within your patient sample. The only catch is that you must be able to report on at least one patient of the 20 for each of the measures. An answer of not done on all patients on one measure will result in a performance rate of 0%, and the provider will then not get the PQRS incentive. Now, let's look at a very easy way to collect this data for the 20 qualifying patients that you will need to report on. Creating a collection data sheet that outlines each of the measures that you will need to collect information on and the applicable answers that may be chosen. Each of these answers are basically one of the quality data codes that will be submitted. Instead of confusing or having to train your clinical staff on the specific G codes, you can instead just have to complete this data collection sheet with the results from their patient visit. One of these will need to be filled out for each of the 20 eligible encounters that you will be reporting on each applicable measure. This will then be used later to submit the completed data to the registry of your choice. You can identify a list of reminders at the top as the sample above states. 20 patients needed. 11 need to be Medicare fee-for-service patients. The patients must be age 50 years or older. Again, an answer of not done on all patients on one measure will result in that 0% rate. And then again, measures can be performed or ordered by a provider different than the one reporting PQRS. So now that you have all of your data for the 20 sample patients, you will need to report that information to a registry of your choice. There are other options for reporting claims and GPRO, but for Measures Group, Option Registry is the only one available. Again, not a difficult process. CMS provides a registry list on their website. This document includes detailed information regarding the services each registry offers, the costs that are incurred, and as well as the measures they have available. Eligible professionals wishing to participate in a qualified registry need to go to the link provided, and it will take you directly to this document for your review. Most registries have a website that you will submit the data to, either directly into the site or upload documents that have the data for each of the qualifying patients in your group measure sample. Once they are submitted to the registry, they will properly prepare the data for submission to CMS. The deadline for submission is March 31st, 2015, but be careful to make sure and ask if the registry you choose has a different deadline for submission. Most of them will have a deadline a few weeks prior so that they have time to process all of the data and get to Medicare by the final deadline. So to conclude this webinar today, I want to walk you through a few things I hope you got. Number 1, PQRS is important. Number 2, PQRS is not too difficult. Number 3, you do want to avoid penalty and get incentive money. Number 4, your PQRS measure group is the best option. And most importantly, remind yourself that you can do it. It really is that simple. If you have any further questions or need additional assistance, you can always feel free to contact NCG Medical at 1-800-330-1906 or email us at solutions@ncgmedical.com. You can also find more information on us on our website at www.ncgmedical.com or follow us on Twitter, join us on LinkedIn, or become a friend with us on Facebook. That way you can get up-to-date industry news and technological solutions for your practice. I'd like to thank you again for attending NCG Medical's PQRS 2014, Making It Easy.